Hello, today May 12 is International M.E Awareness Day. While Stripy Lightbulb isn't an advocacy platform, it's education, it would be remiss of us if we didn't highlight the fact that it is International M.E Awareness Week and Day. It was chosen as May 12 many years ago because it is Florence Nightingale's birthday. We know that Florence Nightingale had an ME-like illness at some point during her lifetime, and that's why May 12 is International ME Awareness Day. What I would encourage you all to do is keep track of the ME Awareness social media posts that are everywhere on social media at the moment, especially hashtag millions missing, hashtag May 12 specifically for today. It's particularly relevant because COVID-19 is highly likely to trigger ME/CFS in a percentage of people that have had COVID-19. Again, I've said this before, we can't 100% confirm that, but it is highly likely because previous coronaviruses such as SARS triggered ME/CFS. It's very highly likely. We're already seeing anecdotal evidence of people still experiencing fatigue and other symptoms maybe 9-10 weeks after infection. That gets them into the phase of post-viral fatigue syndrome. Post-viral fatigue syndrome leads into ME if symptoms persist. So, in a year or 18 months, we may well see a spike. This is why our training is needed, because I've been an ME advocate myself for the past 6 years, and I've had thousands of conversations with patients. Every single patient has got their own tale of being inadequately supported, either in education, in their workplace, or by a healthcare professional. This is purely and simply down to a lack of education, which is why I created Stripy Lightbulb. It is the first of its kind worldwide. It's CPD accredited. Throughout the courses, I have to say, due to a lack of research in this area, I can't 100% confirm this. However, anecdotally, we know it from patients. Anecdotally, we know it from talking to doctors and scientists. It's purely because of a lack of research funding. But where evidence is available, I have supplied it. Our courses are very well researched. And it's an engaging, interactive course. Everyone that's done it has said that they enjoyed doing the course. I've done a training, teaching course qualification to make sure that I deliver effective teaching, so that when you do my course, you understand what ME/CFS is, why there are two names, how it presents itself in a patient, how it could affect you in your own working environment if you are a healthcare business or education professional, and how you can support patients within that environment. So if you are an employer and you have a duty of care over a patient, maybe you need to work out what the reasonable adjustments should be, what kind of hours would be suitable, what tasks they can and can't do, what would they struggle with. There is no other training worldwide to tell you that information. You can get that from me. And trust me, when you all get out of lockdown and go back to work, you will have ME/CFS on your radar. And even if COVID-19 doesn't specifically trigger ME, the illness that it does trigger will be very like ME. So any hints and tips I give you to support ME patients will be invaluable in future. ME/CFS already affects 1 in 500 people. That was pre-COVID-19. And I, for one, as an ME advocate and as owner of Stripy Lightbulb CIC, am praying that the numbers don't go up massively. Please do arm yourself with information and knowledge, because you will see increased numbers of people with ME/CFS. What you need to know is it can take, charities say on average it takes around a year to get a diagnosis of ME/CFS. It took me 2.5 years, and I've spoken to hundreds of patients where it's taken a minimum of 5 years to get a diagnosis. And you need to be aware of that, because if you're putting pressure on someone to come back to work and they keep saying, nothing's showing up in tests, my doctor doesn't know what's wrong with me, how are you going to deal with that? Would you know to reduce their working hours? Would you know that their symptoms fluctuate? This is what you need to know, which is why I've set up Stripy Lightbulb in the first place. So like I say, please do engage with M.E Awareness Week, which is from yesterday until Sunday, and International M.E Awareness Day, which is today, May 12. Please engage with it, because awareness is for those people outside of the ME/CFS bubble. There's no point us just being an echo chamber of, did you know this, did you know that? Because patients know about their own condition. Admittedly, if you're newly diagnosed, you have to go through that phase of learning stuff because your doctor simply doesn't know. Only around 5 to 10% of medical professionals worldwide receive training on ME/CFS. There's a lot of stigma, a lot of false beliefs, misconceptions surrounding the illness. So patients have to educate themselves about their condition, which is why there was no training that existed worldwide until Stripy Lightbulb came along. So ME Awareness Week is for the wider world to engage with. Please engage with it. I've written an article for my local online newspaper, the Star and Crescent. I will be sharing it on all of Stripy Lightbulb's platforms. Please read it. It's concentrated on COVID-19 and the implications on ME. Please read it, comment, ask questions. That's what I wrote it for. Enjoy International ME Awareness Day. Thank you for watching this video, and please sign up to my courses. They're currently discounted at £12 for 3 hours of learning, 3 CPD points. Thank you very much.